Okay, so what's the difference essentially between surgical liposuction and weight loss? More specifically, weight loss with the help of medications such as Ozempic and Mounjaro. So when you're losing weight naturally, for one, you can't spot reduce anywhere because when you're in a calorie deficit, whether it be just through your willpower or help of medications, all your fat cells in your body are just shrinking and you can't target a specific area. So yes, you will lose a lot of weight on the scale as a result of being on certain medications, but you're just going to shrink in that same sort of silhouette and shape that you are. And many patients find that they get to a healthy weight or a weight that they're happy with for the majority of their body, but they still might have stubborn areas of fat which just will not change. They'll be smaller, but they'll still be there. So this is when patients come in to get these areas removed surgically to get to the body that they were after in the first place. The common myth about liposuction is that after liposuction, if you were to gain weight, that fat somehow miraculously goes elsewhere. Now, this is very far from the truth. What is happening is when you're gaining weight, because you're essentially in a calorie surplus, the fat cells that you have and wherever they may be located, they're just getting bigger. So after liposuction, the certain areas that we targeted, those areas are significantly depleted of fat cells. What that means is with a certain amount of weight gain, yes, those existing few fat cells will enlarge, but you're not going to see a huge difference in overall volumetric difference. So other areas are going to get big as if they would have, even if you hadn't had liposuction. But relative to before, where you had other areas of which were of more important concern or more obvious sort of protuberance and size, the other areas that you didn't have liposuction can appear bigger when you're gaining weight. But it does not mean that those areas are now bigger than if you hadn't had liposuction to begin with. So how do I assess a patient's suitability for surgery? So the two factors that I consider most important are the patient's safety and the patient's satisfaction. So from a safety perspective, it's not just the medical, but also the psychological aspect as well. So we assess all that in the two consultations that we have. And in terms of satisfaction, basically what I feel I can deliver to the patient and what the patient is after, they have to be in line. If what the patient is asking for is something that I believe I can't deliver, then I'll be just honest and straight up and tell them I can't do that for them. Now, this applies a lot to our revision cases. So in the last couple of years, I've been doing a lot of revision cases on patients who've had surgeries overseas. Now, I see a lot more revision consults, doesn't mean I take them all on. Some, if I feel confident that I can improve from what they're at, then definitely I would like to help them. But some patients are at a position where I don't feel what I can do with my hands is going to be able to improve their appearance. In those patients, unfortunately, I turn them away.